So, what's that old saying? Nothing in life is free? Well, that's pretty much correct. So, let's talk about the hidden true costs of Medicare Advantage plans. My name is Ed Weir. I'm a former manager of the Social Security Administration. I help people throughout the country with all things Social Security, Medicare, survivor benefits, disability. So, give me a call or schedule an appointment, and I'll put the link in the description below. All right. So, yeah, nothing in life is free, I guess, except for this YouTube video and my help. But I guess you pay for the YouTube video. YouTube is probably making you watch some commercial, so I guess you're paying for it in that respect. So there's that. All right. So Medicare Advantage plans, you see a lot of them out there, zero premiums. So you're like, wow, free. Actually, it's CMS, the Center for Medicare and Medicaid Services, the government organization that kind of runs Medicare, Medicaid, oversees Medicaid in the states. Um, they prohibit in Medicare insurance agents, including myself, broker. I'm actually a broker. I deal with many companies and help people find plans. But they prohibit us from saying the word free when it comes to premium. You can say zero premium, but you can't say free. And it's kind of strange, isn't zero free? But I agree with 100%. So because it's zero premium, Medicare Advantage plans, number one, you've already paid for it. That's how that gets funded. When you worked those many decades and you paid into your FICA taxes, part of that went to Social Security, the other part went to Medicare. So you're already pre-funding your Medicare. Part A is, we can say free because that's a government, is zero. Part B this year is $164.90. Not sure how much it's going to be for 2024. That'll be probably announced very soon here in November. And then Part C, those are the Medicare Advantage plans. Part D, as in David, those are the prescription drug plans. There's a cost for those as well. And then there's the Medigap, the Medicare supplement plans. You've heard with the different the letters, Plan F and Plan G and Plan N. I have a video on that as well. So those are the ones with the monthly premiums, average throughout the country, $100, $125 or so, depending on your particular state. Give us a call and we can give a quote on how much one of those will cost. But in terms of a Medicare Advantage plan, many of those are zero premium. And the cost, the hidden cost, is you are kind of paying as you go. With a Medicare supplement plan, you pay monthly. You have a monthly premium. And then pretty much, depending on what plan you choose, pretty much everything else is covered. Not obviously drugs, you have to get a separate drug plan. If you want dental or vision, you have to get a separate plan. So the Medicare supplement plans, also called the Medigap plans, they cover the gaps that original Medicare doesn't cover. Original Medicare being the A and the B. Okay. All right. So the Medicare Advantage plans, zero premiums, but it's a pay-as-you-go type system. If you have to go to a doctor, then you have to pay a copay. Sometimes you do, sometimes you don't, depending on the plan you choose. Quite a few of them don't have, for your primary care physician, a lot of them are zero. Specialists, not so many are zero. Some of them, depends on the particular plan, your particular area. And then if you ever go to a hospital, you might have to pay there. If you get a test, an x-ray, MRI, you might have to pay there. If you go to urgent care, you might have to pay there. So there are monthly, or not necessarily monthly, if you go to the doctor, I guess monthly, then there are monthly costs, but there are costs, co-payments, co-insurance, deductibles that you will have to pay when you actually use the services. If you don't use the services, then it's zero. People want to ask me, which one should I do? Should I do a Medicare Advantage? Should I do a Medicare supplement? And it really depends on your situation. There is no best plan for anybody. So I get calls all the time, says, my next door neighbor has X, Y, and Z plan. So I think that's awesome. And then that might be the best for that particular person. That it fits that person's budget, might not fit your budget. That person might have completely different doctors than you. So that plan is a terrible decision for you because it doesn't cover your doctors. That is a Medicare Advantage plan. A Medicare supplement plan doesn't matter what your doctors are. If they take Medicare, they take that plan. So that's one of the reasons people love the Medicare supplement, also known as Medigap plans, is because there are no networks. Now, your network is America, essentially. So you can go to any doctor that takes Medicare. So you just, if they take Medicare, they take whatever, Medicare supplement plan you choose. Medicare Advantage plan, the true cost is ongoing, and probably from the calls I get on a regular basis, the giant cost is networks. Yeah, the networks is the networks are the true cost, I think, of if you worked and had an HMO at work, same type of situation. You had networks, HMO, PPO. An HMO is, network. PPO is basically kind of a network, only a bigger network. And if you have a PPO, you have in-network doctors. If you go to, you save a lot of money. If you decide to go out of the network, which you can, it just cost you more money. So those are the kind of differences between an HMO and a PPO. But the problem with the networks is they're so fluid. They change on a regular basis. I've had people that signed up for HMO Medicare Advantage plan, and their favorite doctor that they've been going to for 10 or 15 or 20 years is in network and checked on the carrier website. Yep, carrier website. Yep, in network. And the trick to that is, don't just call your doctor and say, hey, do you take XYZ Medicare plan? Because XYZ Medicare plan probably has 5, 10, 15, 20 different versions. So you have to ask them whether they take the exact version you have of XYZ Medicare company, right? Has to be that particular version. Because what we see sometimes is, yes, they take XYZ company, but they don't take that particular plan for whatever reason. They forgot to fill out the paperwork to also accept that plan, or whatever the case may be. So you have to make sure they take your specific plan. And even then, stuff can change. The doctor next year, forgets to fill out the paperwork, or decides to drop that particular plan, or drop that particular company, or tomorrow, next week, decides to drop them, or the XYZ company decides to drop that doctor, whatever the case may be. So yeah, you always have to be very vigilant to make sure your doctor still accepts your particular version of your Medicare Advantage plan. So that is, the cost of freedom, I guess, is perseverance, right? The cost of zero is perseverance. So it's important to keep up on your Medicare Advantage plan yearly. In September, you will receive an ANOC, the annual notice of change from your particular Medicare plan. And it's a government mandated process, and they have to send it to you and say, next year we're going to change this, or we're going to change this other thing, or we're going to change this doctor network or this hospital network. So in September, it's important that you keep up on it. Reach out to your agent, go online to medicare.gov, give us a call, and we can see if there's anything better for you for next year. And obviously, we are provide A to Z services. Probably we're the only service in the country that can really help you with all facets of Social Security and Medicare. There's a lot out there that said they do, but a 2-day seminar on Social Security, it just sorry, just doesn't do it. Give us a call, and we'll walk you through the entire Medicare process. Make sure you're getting everything you can out of Medicare and your health insurance, and saving all the money you possibly can, and making sure Social Security is doing the right thing by you. All right, we'll talk to you next time. Make sure you share, like, save, all that kind of YouTube stuff. Save, I don't save. So up, like, and whatever it is. All right, have a beautiful day. Take care.